Welcome. This is the preoperative presentation for those of you who are just about to get a total knee replacement or a partial knee replacement prior to surgery. We're going to be going over some information. My name is Chris Lee. I'm from Sport Physical Therapy. We have proudly been a part of providing care at Tri-State Hospital for about 35 years now. And so we're going to be seeing you post-operatively, and we kind of wanted to go over some things today to help you get prepared for the surgery that's coming up, okay? So what I'm going to cover today is home safety. We're going to go over a few basic exercises. We're going to talk about hospital physical therapy, and then plans for home discharge and a few other related topics, okay? So you're thinking home safety. Why are we going over home safety? Well, biggest thing is we don't want you falling, okay? So what I want you to do is I want you to picture yourself as you are getting out of your car and you're going into wherever you live, whether that's in a trailer, whether that's in a home, doesn't matter to me. I want you to think about from the time that you go through that front door to wherever you're going to be going throughout your living spaces, okay? I want you to be thinking about safety. So is your entrance, is it free of clutter? Do you have shoes or papers or power cords or other things that are in the way? Okay, we want you to be picking those things up, trying to move those things out of the way because, again, we don't want you falling or tripping over things. Falling on a new total knee, not a good thing. In most cases, it will take you back to surgery and back to square one. We don't want to do that, okay? Walking down hallways, same thing, okay? Just think about clutter. Think about making sure that you've got enough room. So you're going to probably be using a walker post-operatively. We want to make sure that you've got enough room to negotiate those areas, okay? Going in your living room, getting around furniture, coffee tables, sofas, different things like that, getting into your kitchen, okay? And then lastly, going into your bedroom, okay? We want to make sure that you're thinking about, okay, we want to make sure things are free of clutter. Getting into bathrooms, thinking about, okay, if I have two bathrooms, is there a certain bathroom that's going to work better for me versus another one, space-wise? So just getting some of those things in the forefront and planning for those things. Do you have a night light that you have so you can see adequately at night when you have to get up? Just planning ahead for some of those things, okay? And then typically we would give you a handout, but you're here, okay? Now, what I would like to do now is just go over some of the basic exercises that we're going to maybe have you start to work on preoperatively prior to surgery, okay? So we're going to use this bed as a demonstration. So if we're down here, one of the things that we want you to start to do is if you've been using like a pillow or towel at home to prop behind your knee, we want you to start to get rid of that, okay? One of the very first things we are going to do is we want to get you straight. So try and get rid of pillows or towels behind the knee, okay? Now, from an exercise standpoint, one of the very first things we're going to work on is trying to get your thigh going or your quads, okay? The way that we want you to do that is to tighten up your thigh and try and drive your knee down using those muscles. As you do that, everything straightens out. We want you to pull your toes back just a little bit so everything gets nice and straight. You're going to hold for about 8 to 10 seconds and then relax, okay? We usually recommend about 10 repetitions, so 10 times, 10 seconds. Pretty simple. The next one that you can do is to squeeze your bottom as well. Okay, now for those of you, probably about 30 to 50% of you are automatically going to, as you tighten up your thigh, you're going to squeeze your bottom. It's just going to happen automatically. So we recommend try and do both, okay? Then we're going to have you you can either be laying down, you may be laying on your bed or on your couch, recliner laid all the way back. So we want you to start to slide your heel up towards your bottom into a stretch. Don't make it hurt. So on a 0 to 10 scale, I'm okay with like a 3, 4, but if you're hitting a 5, 6, you're pushing too hard. We want you to back off. I want you to hold for about 8 to 10 seconds and then straighten it back out, okay? And do 5 to 10 repetitions, probably a couple times a day. Okay, that way we get your motion going prior to surgery and things are going to work a little better for us. The last thing is what we call a straight leg raise, okay? So you're going to bend your good leg up, you're going to tighten up your thigh, pull your toes back, you're going to lift that leg up about 4 to 6 inches, and then back down, and then relax, okay? So tighten, lift, hold 1 or 2 seconds, back down, relax, okay? So for those of you who have had prior back surgeries and it really hurts to lift your leg up, there are alternative exercises that we'll show you in the hospital and positions that we can go through. So I'm not gonna have you stress about that. So basically, if you're getting 5 out of 6 pain, hold off or skip that exercise, okay? But try and work on a few of those because we do think it does help prepare you for surgery, okay? Now, let's talk about what you're gonna get from us as we see you post-surgically after surgery, okay? So you're gonna be getting some bed or seated exercises depending on how we do it, okay? We're obviously gonna be going over kind of what we call gait training or how to walk using this new joint, okay? How to step, how to weight bear, different things like that. Some of you are gonna do just beautifully. You're gonna feel like, oh my heck, my pain is very well controlled. Some of you, that is the pain meds or the pain block that's going to be in your system, okay? You might feel great, but we usually tell you within 1 to 2 days that pain is going to change and it's going to change the way that you're moving, okay? Now, how to get in and out of bed, how to get in and out of chairs, on and off the commode, things like that. We want to make sure that all of these transfers go safely. The last thing, like I said, we want you doing is we don't want you falling, okay? Again, what you're going to receive from us, for those of you who have got a few stairs that you need to go up to get into the house, we want to make sure that we get the mechanics of that going fairly well because we want you, again, safe, okay? Lastly, we're going to touch on getting in and out of the car. We all have different cars. They're, you know, from really low to really high. Probably don't recommend trying to climb in a giant 4x4 post-surgically. So for those of you who are getting picked up by family members, make sure that they bring something that you can get in and out of safely, okay? And then going over your home program. So we're gonna give you a handout that has pictures and descriptions post-operatively that you'll take home with you, okay? Now, the day of surgery, okay, for those of you who have surgery, like you're one of the first couple of cases, okay? What will happen is, if you get back from surgery, there is a possibility between 3 and 5 p.m. that we may come in and we may see you. And you're thinking, well, why are they doing that? Well, because we find that actually patients do better, okay? So depending on how bad your pain is, and you're gonna be sore, or you may feel great, like I said, we've seen the full gamut. Whether or not you're dizzy or lightheaded, okay, and whether you have enough control of that surgical side, we may do some bed exercise with you, okay? We may get you up and do some walking, and whether that's just standing at bedside or whether we actually walk in the room or even down the hall a little bit, everybody's a little different. We're gonna adapt what we do to you, and we're not just saying, okay, we've gotta do this much right now, because we wanna make sure things are safe and that you can do this, okay? We're gonna go over home program with you, like I said, give you handouts, and then maybe talk about car transfers and stairs. So sometimes we get through all of that, sometimes we just get through 1 or 2 things with patients. Everybody's a little different, okay? There is newer research that is actually starting to show that patients who get up day of surgery and do some walking do better functionally and are usually discharged better in a better function than those who don't, okay? And that is gonna be all over the map, okay? So, for those of you who spend the night, okay, and that's going to be the majority of you, okay, we're going to come in early in the morning between 7 and 9 a.m. We're going to start to do some bed exercise with you, okay? Then we're going to do some walking. For those of you who we walked the day before, we're repeating that, and then we're going to try and build on that distance and make sure that we get to walking a little further, okay? We're going to make sure that you're icing that knee regularly, okay? You're going to typically get a gel ice pack from the hospital. Some of you will get a cryo cuff. It just depends on how they play that out. For the first day or 2, we recommend definitely, if you're going to get out of bed, out of chairs, anything like that, to definitely use your call light, okay? Call before you fall is the mantra that the hospital is going to try and chant you. We don't want you falling, okay? As we come in and we start to work with you, your pain may be starting to climb a little bit. So we may be at a 4 or 5 on a 0 to 10 scale pain-wise. We usually find that that is okay. Patients sometimes are a little hesitant to that, but what I find in most cases is once we get through the exercises and we walk a little bit, most people tell me, hey, I actually feel a little better now. So don't let the pain hold you back. You are going to hurt, but we don't want agony as we're doing the exercises and treatment, okay? The goal really is to get you in the chair for all of your meals. The reason that we want you in the chair is because you breathe better, because you digest or you eat better, and you're better functionally if you're getting up for all your meals. And so I want you to get in that mantra and think, I got to do this. Some patients, good, bad, or indifferent, as they come to the hospital, they almost treat it like they're on a little bit of a vacation, okay? You're not. It's going to take work to get you better. And so from the time that you get out of recovery, that's when the work starts. But it will pay off, okay? You're going to be happy with this. So for those of you who are doing well and we need to, we're going to go over those stair mechanics with you, okay? We're going to talk about car transfers and make sure that, you know, we can give you little tidbits that kind of help you get in and out of the car. And then likely discharge for most patients the first day post-operatively. Sometimes that's as early as noon, sometimes it's mid to late afternoon. Everybody's a little different depending on rides and paperwork and everything else, okay? Now, there are some of you who are going to be a little weaker. You're going to be having a little harder time coming out of anesthesia. You're going to have pain issues, other things, and complications we can't foresee right now, okay? So some of you are going to spend a second night, okay? We come in day 2 post-op. We're going to be doing things. We're going to be trying to increase that independence. So again, we're going to go through your bed exercises, okay? It's really important. We want you walking, trying to improve that independence. And yes, you can do this every 2 to 3 hours, but again, we're going to still strongly recommend that you have somebody with you. Whether that's a nurse, whether that's therapy, we recommend for safety's sake to do that, okay? Icing, really important. We want to keep that swelling controlled. If your swelling is better controlled, your motion and your strength are going to be better. If your motion and strength are better, you're going to move better, okay? Going up and down steps, for those of you who we haven't done that with, okay, we're going to go over that at that point. Car transfers, for those of you who we haven't reviewed that with, and then either going home or possibly transitioning to a rehab facility. There may be those of you who just don't have enough help at home, and you may need to go to a rehab facility for a week or two to just build your strength up and become a little more independent before you safely can go home. Now, precautions. With knees, there really is nothing that we're worried about aside from don't put anything behind your knee. So get out of those pillows behind the knee. We want to get you really straight, and the reason that we want to get you straight is because it's how you're walking. It's the mechanics of gait. So you're going to take a nice long heel to toe stride if your leg is really straight. If it's not, and these guys, your hamstrings back here are tight, you're going to limp, and your step length is going to be shortened. Okay, so we want that straight. What we expect from you to go home, okay, is we want you as independent and safe as we can be with getting in and out of bed, getting in and out of chairs, commode, things like that. We want you safe with those transfers, okay? We want to have you walking anywhere from 100 to 150 feet. Some of you are asking, okay, why that distance? Well, what we have found is typically patients who are able to do those kind of distances are able to safely get from the car all the way into the house, and they're not running out of energy before they get there and thinking, oh my heck, I need to sit because I can't do this, okay? So we don't want you to be one of those people. We want to work on those distances a little bit, okay? For those of you who have to do steps, we want to at least make sure we have those mechanics down so you're safe again, okay? Bed exercises, we want you understanding those, okay? Positions, holds, techniques, and repetition is the master teacher with all of us, okay? Getting up for meals, again, don't eat in bed, okay? Patients frequently ask me this question, can I hurt the hardware, okay? Is it fragile? No, okay, put your mind at ease, okay? About 20 minutes after the surgeon puts that hardware in your new knee, that thing is solid, okay? It's not going anywhere. What hurts is where he made the cuts on your bone to get the hardware into place. So regular walking or going up and down a few steps, you're not going to hurt that hardware, okay? It's solid, it's safe, okay? Now, we frequently also get the question, can you heat your joint, okay? Well, for the first 2 weeks, we don't recommend doing that, okay? Try and keep ice away, especially on top of your knee. Some patients, we will say you could put a little behind your knee, but we recommend try and avoid it for a week or two because your body post-operatively is dealing with a lot of post-surgical inflammation. We want to let that inflammation start to calm down before we start to introduce other things, okay? So give it a week or two, and then as we kind of take a look at things and we can see how your tissue is responding, we'll tell you when it's usually safe to introduce the heat. Now icing, absolutely, okay? 4 to 6 times a day, 15 to 30 minutes, okay? Icing is one of those things that is just crucial, okay? Typically you'll get either cryocuff or the gel packs of the ice. We also have an ice bag recipe that is on our exercise sheets. You mix rubbing alcohol and water together in a Ziploc baggie. It'll cost you like $1. Patients also ask, hey, can I use frozen peas or corn? Yes, you can do those things as well. But again, the thing is we want to control that swelling, so consistent, but we don't want it constant. So I don't want you throwing an ice bag on there and leaving it on there for 24 hours. We want to improve the blood flow, and that's what ice does, is it improves the blood flow, but it gets rid of the swelling. But too much ice will actually slow your blood flow, so we don't want to do that, okay? At home, we don't want you going home and just doing this, okay? So you're going to have to ice, okay? You're going to have to do your exercises. We want you walking regularly. I'm talking 3 to 5 times a day. So that's separate from meals, separate from bathroom trips. Now, that's not unlimited activity, so don't go crazy. Okay, there will be days where you're going to feel like, man, I'm amazing. This feels good, so you're just going to go for it. You may pay for it. So listen to your body, okay? Remember, the doctor's done his work. And so what I tell patients frequently is, now that he's done his job, if you'll do your job really well for about 8 to 10 weeks, you're going to be happy with this new joint for years to come, and it's going to be very effective for you, okay? Elevation, okay? Do we recommend it? Yes, absolutely, okay? Looking at this picture, this is how we recommend you do it. So we want you propping from about mid-calf on down, okay, and getting that leg at or above heart level. Can you do it in a recliner? Maybe. If the recliner lays back far enough. I usually recommend you physically getting into bed or on a couch and then propping your leg up. What we want is no pillows behind the knee. Again, we want to make sure those tissues are straightening out, okay? Lie on your back with your leg higher than your heart. 2 to 3 times a day, we recommend about 20 to 30 minutes. What this does is it gets that fluid dumped out of your leg and back towards your heart, where your heart can get it to your kidneys and then dump it out of your body, okay? Again, if we can control the swelling, your motion and your strength are going to be better, okay? Post-op rehab, okay? Do I need additional physical therapy? Well, if you ask a PT if you need additional therapy, what's the PT going to tell you? Yes, okay? Of course we recommend that, and there are several reasons that we recommend that. Well, we're biased, but research actually shows that patients who do get a little formal therapy really do better than those who just get a handout and saying good luck to you. Okay, let me go over some of those things. So what does outpatient therapy give me? Well, it really does give you quicker gains in your motion, in your strength, okay? We adapt the program to you. So even though I'm going to do similar exercises with a lot of my total knee patients in the first 3 to 5 weeks, I'm going to adapt those exercises to how you are doing at that time. I'm not comparing you with Mrs. Jones, who is across the room, or somebody else who left earlier in the day. I know what time frames I need to hit, what exercises are appropriate at what time frames, and what your body is going to be ready for. If it's not ready, we're not doing it, okay? A better understanding of what's okay, what's too soon, okay, or even maybe too slow if we need to pick up the pace a little bit, okay? We sometimes will talk about how to wean off your pain meds. For the first 2 weeks, if you need them, please take them, okay? Do not think you're going to get addicted to your pain meds in 2 weeks. This joint is going to hurt. So Tylenol is going to be like taking Tic Tacs for you. You're going to need something probably stronger, okay? A knowledge of the physiology and what is going on with your body, okay? So if we see something that is just not clicking, okay? We see signs of infection. We see signs of abnormal swelling, other things like that. we are going to be in contact, and we are a great advocate with you and your surgeon, okay? We have a good relationship with your surgeon. We can contact them, most of them by texting immediately, and they get back to us immediately. So we have a very good rapport that we have spent years developing with your surgeon, and they trust us to see those things happen and let them know immediately if something is just not right, okay? But in most cases, the surgeon will say, we're okay, you know, let her keep her appointment. In some cases, they'll say, I want to see her today or tomorrow. And that helps to have that relationship. Basically, what we're looking at is a quicker return to function for you. So you could go home and you could follow Dr. Google or Dr. YouTube's advice. The problem is you're going to be doing calculus before you should be doing basic math. Okay, you're going to be doing exercises way before you should be doing some of them. So we are going to build a proper foundation, a proper base for you, and then build the house after that. We find if we do that, you're going to have a better overall function, okay? How long does therapy last? Well, it is really function, not time dependent. So we're looking at good gains in motion, in strength, in balance, in walking, in swelling, putting all of that together and making sure that functionally you're where you want to be. Typically, if I find my patients are 70 to 80% improved, I usually can start to wind down and start to turn them loose, okay? Usually for knees, that's about 6 to 8 weeks, okay? It varies though, okay? How long should you use your walker, your crutches, cane? Okay, again, it depends, and I know you don't like that answer, but we're looking at function, okay? We're looking for certain markers in the way that you're moving, you're walking, you're keeping your balance, you're transitioning from leg to leg. So we're putting all of that together and saying, okay, we're ready to move on from walker to cane or from cane to nothing. But I have had patients in the past come in and say, hey, look, I got rid of my device, and they're limping along, and I'm like, no, you shouldn't have done that. You're not ready. Your body's not ready to do that, okay? Don't get rid of your assistive devices too early, okay? So try and follow our guidelines if you can. How far should you walk, okay? I tell people listen to their surgical side, okay? It will know when it's tired or if the pain's climbing too much and it needs a break, okay? Call that your halfway point or your sit-down spot and just rest, okay? That may be a minute, that may need 10 minutes or 30 minutes. Everybody's a little different, okay? We typically recommend increasing your distance about every 2 to 4 days, and then bit by bit, you'll get back to those community distances that you need to do, okay? What about stairs, okay? Some of you, we're gonna be going over that mantra, up with the good, down with the bad, okay? We're gonna go over that and make sure that you've got that down, okay? For those of you who have, you know, laundry down in the basement or a man cave or something like that, a sewing room, whatever, try and avoid those areas for the first couple weeks, okay? Because 12 to 14 steps on a regular basis consistently during the first 7 to 10 days after surgery, it's gonna make that knee sore. So try and minimize that. If you can be on a main level, try and be on a main level. That really helps functionally, okay? Driving, okay? If you're on narcotic pain meds, we usually say wait. And so we usually say give it 2 to 3 weeks, okay? With the left leg, with an automatic car, probably within the first couple of weeks, you can start to do that, okay? With the right leg, with the total knee, it could be anywhere from 2 to 4 weeks, okay? But what we're looking at really is we gotta look at 2 things. One of them is we got enough motion. 2, we've got enough coordination to go from gas to brake pedal really quick, okay? We want you safe as you get out and about in the community and you start to resume driving. We don't want you to be thinking, oh no, I'm not gonna be able to react quick enough. So we'll kind of give you guidelines on that. In the end, really, it's all about balance, okay? And you're going, okay, what do you mean? Well, in our society, we think if a little's good, a lot's better. With total joints, throw that mantra out, okay? It's a little at a time. So what we need is some exercise, some walking, some ice, and then the rest is rest, okay? Your body's gonna put it together. You're gonna feel more tired, and you're gonna think, why am I so dang tired? Because you just had major joint surgery, okay? This is not like getting your wrist scoped, okay? It's gonna take time for your body to get back. So don't go home thinking in the first 2 weeks, you're gonna just get back to mowing the lawn and doing car maintenance and stuff like that. Put that stuff off for several weeks. Make sure you've got that taken care of or planned ahead for, and let your body heal, okay? You'll be happier if you do that, okay? Down the road, okay? When can I put on shoes and socks? Well, as soon as you can bend that knee, pull it off, okay? Kneeling, I usually tell my knee patients at least 4 to 6 months. Reason being is because it's a pain thing. You're gonna attempt to kneel down, and some patients are able to do that between 3 and 5 months. Other patients, it's 4 to 6 months. I've even had the odd patient at 4 or 5 months. They start to kneel and they're like, oh my heck, that really hurts. This is brand new hardware in your knee. Your bone sometimes can put up with that pain, sometimes it does not. There are some knee patients who they're done with kneeling once they have that total joint. And so I tell them, if you need to get down to a lower level, you're gonna probably need a little stool or something to sit on. So it's gonna change the way that you do certain things, okay? Walking long distances, usually within about 3 months, you're back to community distances, your Walmart, Costco, stuff like that, okay? Outdoor activities, gardening, hiking, golf, usually within about 3 to 5 months, we're back to stuff like that, okay? Now, if you have additional questions and you're like, man, okay, what about this? Or he didn't go over this. Write them down, okay? You can play this video again, you can review it and see if I've covered things. If I haven't and you've got additional questions, write them down. And then when we see you in the hospital, we can go over those questions, okay? We do recommend therapy, but thank you. I appreciate your time, taking the time to go through this video. We look forward to seeing you soon.